so many times throughout the day, the average person is utilizing a deep squat in some capacity or could benefit from using a deep squat in some capacity where we're just not ever going to train that in the gym and expect our body to be able to do it.
Exactly. You guys, we know the age-old saying, if we don't use it, we lose it. And if we are now going to start to pick up babies off the ground or do something around our house, but we're never training it, are we surprised that we're in pain? Are we surprised that our knees hurt? We can't just look at the diagnosis and say, this is why we have pain. Now don't do deep squats. That's just not substantiated now. Welcome back to the Optimal Body Podcast. I'm Doc Jen.
And I'm Dr. Dom.
Doctors of Physical Therapy, here with an episode all about deep squats. Should you be doing them? Now, before we dive into what the latest research is really saying about deep squats, are they good? Are they beneficial? Are they not beneficial for our knee? And are they dangerous? We're going to dive into all of it today. But we also want you to know that we dive into a lot of other topics on this podcast, whether it's questions that you've asked or things that are diagnoses or just latest research. Like, we want you to help understand your body and what's best and make informed decisions. So don't forget to hit that subscribe button. Also, because I have a lot of movement videos, so whether you just want to do a mobility flow with me or exercises based on a diagnosis, I have a ton here for you. So don't forget to subscribe and always leave a comment with any suggestions you might have.
Okay, tackling the age-old myth of, are deep squats bad for my knee? Should I not be going below 90 degrees or parallel squats because it's going to hurt my knee, damage my cartilage, give my knee more laxity? This is something that I feel like has been a persistent talking point of squatting below parallel is bad for your knees.
And I think in particular, there is a popular, I think he's a trainer, or is he I think he's I don't really know what, I don't know if he's a clinician or not. I'm not going to say his name, but he is really popular in social media on, perpetuating that you should never go below 90 degrees for squats. And the most power that you are going to build and the best that you are going to be is squatting to 90 degrees. He doesn't even say parallel. He says to 90 degrees is like what you should be doing. And so let's talk about it, because I think there is a lot of fear, especially if you have things like arthritis or anything happening within your cartilage or osteoarthritis, or you've been told not to do deep squats anymore. Like, let's look at what the evidence is actually saying.
So where does this come from? Where does this, notion of don't squat low come from? And where it kind of originally is tracked to is this research paper that came out, or a dissertation that came out in 1961, that concluded that full squats led to knee ligament laxity. And really, when you dig more into it, this study kind of uses questionable methods and says that there is knee ligament laxity by using basic goniometer measurements. One, I don't know how you could determine laxity using a goniometer. A goniometer is essentially what, if you've ever been to a physical therapist's office, it's becoming kind of an old school thing now, because there's a lot more like modern technology that people use, but to like do joint angle measurements. It's this little plastic device that has two arms, and you kind of measure the angle of someone's knee or shoulder or hip or whatever.
Yeah. So you might especially see it if you come back from like surgery. Yeah,
absolutely. Hopefully it's something that is kind of going out, because I know that there are different like apps and devices that can maybe be a little more accurate, because there's research on goniometers itself and how inaccurate they are between people. Like, two people might measure the same joint and get completely different measurements. But yeah, it ends up being very weak evidence that has then influenced from 1960 this whole concept of deep squats being bad, and it's influenced physical education, coaching, military training, so many things that took this one line from a study, deep squats are bad, and kind of applied it to all of their education.
1961. It's just crazy to think of like how long it's been and how long these things stay around and get perpetuated because of this. And that's why it's so important that we get to continue to do good research, right? And understand, what's really happening. And so when we look at like the scope of all the research available, all the evidence available on deep squats.
I like how they call this a scoping review.
Yeah.
It's not just like a meta-analysis or anything. The scoping review where they review all the research, even if they don't use the exact same methods. And that's the main paper, Rojas. Oh, I got myself in trouble. Rojas Jaramillo and et al. So he and his research buddies did this scoping review.
Yeah, from 2000 to 2024 is what it's looking at. So that's the time frame of the studies. And we're looking at just healthy adults primarily within the study. And what they found of these 15 studies that they looked at, 13 supported safety in being able to do deep squats, and 2 really kind of raised some concerns. And we're going to go into what some of those concerns were. But I think, if we look at the broad scope of 24 years of data, and saying that 13 of these studies are showing it's completely safe to be able to do a deep squat, that's something to look at.
I think that, first of all, meta-analysis and scoping reviews like they did here, it's crazy when you initially look into the methods of how many research studies they at least look at and read through, like thousands.
Yeah.
These people are looking at thousands of research studies to narrow it down to the 15 that they include because they're similar enough, or they're studying and comparing parallel versus deep squats so that they can include it in this study. They're looking at all of the most recent research only to get 15 that they feel like
and
are most
quality.
Yeah, most relevant to this topic. So what? The 2 that reported risks or said that there are some risks. One case reported links between deep squatting and meniscal injury, but it was anecdotal and confounded by other risk factors, which we're going to talk about a little bit, where most of these studies were done on healthy adults, where maybe they're talking about risk factors being that this person already had a predisposition to knee injury or something to that extent. And one review warned of increased cartilage stress, but this was largely based on modeling, like saying, okay, we're increasing the shear forces on the cartilage in the deep squat. It wasn't actually related on people getting injuries or having cartilage injuries throughout the duration of the study. So there was no long-term follow-up. So even those 2 that reported some concerns,
there's a lot that we have to look into with
the
that.
concerns are kind of weak.
Exactly. But what we looked at and saw some positive adaptations from those 13 other studies, they saw improved strength, tendon resilience, and functional capacity. Those are huge, because when we look at especially the other factors when it comes to meniscal injury and cartilage stress, that's going to happen in time. Even if you weren't going to train deep squats.
Yeah.
You live, you age. If you have the privilege to do so, your cartilage is going to be affected.
Absolutely. When we look at, I don't know the exact numbers for cartilage degeneration or knee osteoarthritis.
That should be our next podcast.
But you image 60 people's or 100 60-year-old knees.
Mm-hmm.
The percentage that are going to have degeneration of cartilage, even without pain, is going to be so high.
So there was a study that looked at 230 knee MRIs of subjects aged 25 to 75 years old that were completely pain-free.
These are asymptomatic people.
Asymptomatic people. 62% had signs of osteoarthritis and 41% showed level 4 severe arthritis and still no pain.
Yeah. So again, that point being towards, as we age, we're going to have some degree of degeneration in our knees.
Yes.
That can vary, of course, from person to person. So where was this initial concern, or is there any cause for concern? Because I think what people look at when they're looking at biomechanical models is the deeper that we're getting into that squat, the higher the either compressive or shear forces we're going to have in the knee joint. Wouldn't that be concerning?
Well, when we're looking at like the compressive forces of the knee, we have to look like Coder et al. In 2013 showed you have to look at both the load and the depth. That combined kind of makes that peak knee flexion force, right? So it's not just being able to squat deep, but it's like how much load are you actually putting on that also has an impact in it. And then we have to look at, that's just the knee joint force. But then when we look at the patellofemoral force, which is kind of like when we're talking about the front of the quads and the front of the kneecap area and how that affects the knee, right? We actually get contact stress increase between standing straight and 90 degrees of flexion. But beyond 90 degrees of flexion, we have an increased contact area that helps to distribute that force. So it's not as compressive just at the front of that knee anymore once we go past 90 degrees.
Yeah, meaning that at 90 degrees, we are probably having the highest amount of compressive force of the meniscus, of those cushioning structures in our knee. But then when we go past 90 degrees, the area that that compression is put on is larger. So we have less compressive force overall.
Well, we're going to put more tension into our knee, more tension into our hip. So it gets dispersed a bit more rather than just being focused at that knee.
I think another important thing to point out, and kind of moving into some of like the nuances of this discussion, is that we're not talking about someone who's untrained suddenly going in and doing a
Heavy.
max repetition, low back squat, getting their ass down to their calves.
Yeah.
That would be silly because that's just not proper progression of exercise. Right. Like someone who's untrained isn't going to suddenly jump in and do that. And we need to think about how our tissues in our body adapt to the load that we consistently put upon them. Mm-hmm. So if you're starting out working on form, doing squats within your comfortable ranges of motion and working to a progressively lower squat, doing body weight, and then working into progressive loading, whether it's, goblet squats or doing a light barbell back squat or front squat. And then again, our tissues are going to continue to adapt. Our nervous system and our muscles are going to continue to adapt to be able to take on that stress.
Exactly. I think something that we have to point out, obviously, if you're in pain and it hurts to go beyond a certain range of motion, you're not going to be going beyond that range of motion right now. Maybe you work up to that. But I also I think back to my mom too, who's always, she grew up in the generation where it was always keep your knees over your ankles. Don't let your knees go past your toes. So a squat didn't have the ability to go into a full depth because you cannot go into a full deep squat unless your knees go forward towards your toes. We have to have adequate ankle mobility in order to go into a deep squat. So and it's interesting because when I've trained with her, a lot of times we'll do heels elevated goblet squats, and she's so used to getting her bottom way back, her knees over her ankles, that she doesn't go into that deep squat. Even though she does yoga every day, she can sit in a deep squat. She can feel comfortable in a deep squat. So she can hold a deep squat. She just doesn't. It's like a neuromuscular retraining of how to now go into that deep squat under load. And now she can, because I have
trained it.
Yeah, right. We've trained it where it's like, wait, you can go into this deep range.
Yeah.
You've just conditioned yourself to not even be able to hit that full range. And so now when we do heels elevated, she's going into a full range deep squat and coming out. And kicker, guys, she's got knee osteoarthritis.
And it's so funny when you bring that up because you watch her, I think about with our kids, she watches our kids for us and she'll squat down to the ground and be there on the ground with them. Again, deep squat, she gets really low, but then you suddenly put her in a training environment and ask her to do a squat and her butt immediately goes back. Mm-hmm. It's like, no, just act like you're squatting down to the ground to get Dante or to play with Dante. But there's this thing in people's minds like, oh, once I'm training, knees over ankles, I can't do that. But functionally, which is why it doesn't make sense to me, the person you were talking about who said we should never be squatting past 90 degree, like, okay, have you ever just gotten down to the ground or
lived,
sat on a low curb or anything? So many times throughout the day, the average person is utilizing a deep squat in some capacity or could benefit from using a deep squat in some capacity, where we're just not ever going to train that in the gym and expect our body to be able to do it.
Exactly. You guys, we know the age old saying, if we don't use it, we lose it. And if we are now going to start to pick up babies off the ground or do something, around our house, but we're never training it, that's where, are we surprised that we're in pain? Are we surprised that our knees hurt? We cannot, again, I go back to that study that I, named off that had so many people who had knee osteoarthritis and no pain. We can't just look at the diagnosis and say, this is why we have pain. Now, don't do deep squats. That's just not substantiated now.
So just kind of some practical takeaways from everything that we just said with relatively healthy individuals, athletes, just general exercisers and movers, deep squats are okay and actually can be quite beneficial when progressed well and progressed intentionally so that your body has the time to adapt.
And then when we're talking about like, in rehab settings, that's where we have to listen to our symptoms. So obviously I wouldn't have my mom squatting all the way down to the ground into a deep squat if she had pain in that range. So you're listening to the pain, you're listening to your body, and you're doing what you're able to do, progressing it as we've talked about over time. And when we do look at studies that look at patellar tendinopathy, and we've done podcasts just on this, actually being able to just hold and squat to 90 degrees, because that's putting more of that compressive load at the front of the knee, which is where that patellar tendon crosses, that's going to help to, rehab that tendon by holding and doing squats to that 90 degrees. So that's where in a rehab setting, we could use more of that 90 degree mark and actually get some of that benefit and then progress to deeper squats over time as we start to get better.
Yeah. And ultimately, it's something that needs to be done on an individual basis. We can say, oh yeah, deep squats, they can be beneficial. It should be something that you're doing. Of course, we believe that. We believe functionally everyone should be able to get into a deep squat and use that to get to the floor or sit on a very low stool or surface, any of the functional things that can benefit from being able to do a deep squat. But it's going to depend on the individual. It's going to depend on ankle, hip mobility restrictions, knee injuries, or if you do have any sort of knee pain. That's where these modifications can come into effect with the potential hope of progressing back into lower squats. Because again, ultimately we're trying to think about functionality. We know that there's research out there that shows that people who are asymptomatic have the images that look like severe knee degeneration, but still are able to functionally move. So utilizing this knowledge to say, okay, it's not dangerous. It's something that I can incorporate. And what is my best path to do that, to be able to take advantage of some of those benefits? Thanks for joining us for another episode all about those deep squats. Do you do deep squats in your exercise routine, or have you been told before you shouldn't squat past 90 degrees? What did you think about that? Please comment below and let us know if there are other topics that you want us to do some of these podcasts on. Before you head out, make sure to hit that subscribe button and notification bell so you don't miss any of our future episodes.